is Hyrum coming to you live from Digital Health Summit studio with Jim Hattersley at Hyrum.
Yes.
So Jim, tell us a little bit about your company.
Yes, Hyrum is a company that was founded about 15 years ago. This company was founded by a gentleman who is the president and CEO of the company today, Garth Sutherland, who has asthma and is a chronic asthmatic himself, that found, as a physicist by training and knowing a lot about the electronics industry, felt that there were better ways to manage asthma and in particular COPD better ways than what had been in place up to that time. And still to this day, I believe the smart inhaler technology that he helped design and develop is still state of the art and top of the line. 15 years ago, the company was founded as a company called Nexus 6. It was only until last year, 2015, that the company changed its name to Hyrum when it became a publicly listed company on the Australian exchange. So you have a publicly listed company, you have a company headquartered in Auckland, New Zealand, a company that has a lot of global activities in progress, expansion occurring in North America, a major market, like Japan and Europe, and we also have an office in Europe that's just recently established. So not just Australia because of the listing and Auckland, New Zealand because of the headquarters, but also global development. That's the brief background on the company. If we go into a little bit more depth, we can speak about the type of device. We're talking about
Sure.
asthma and COPD. These are conditions that are generally managed, as a lot of people can see out in the industry and in public, with an inhaler device. These inhalers can be dry powder inhalers or they can be meter dose inhalers. So what we design and we develop and we actually produce clinical data and get engaged with producing clinical data that provide outcomes information is to link the device together with an inhaler. So you're really taking the inhaler and turning an inhaler from the pharmacist into a disease management system. That's probably a most important part to have come across with regard to Hyrum. What that really means is you're establishing a closed loop system between the patient and the dosing regimen. It's not being left to chance by one training visit between the physician and the patient in the physician's office.
Right.
Physician's office decides that this is what you need to take as a dosing regimen or a product. This is how you use your inhaler. That's it, goodbye, off they go. Physician goes back to the other patients, patient goes home, and patient doesn't use the device properly, the inhaler properly. The device that we have being attached as part of the inhaler make it a very effective, as I said, disease management system, not just an inhaler. So there are sensors built in, there are reminders, date and time and orientation, effective use, a number of different ways to show that this device is actually doing for the inhaler what we expect it to do.
It's very interesting. So essentially it's not just the device itself, it's sort of like, the patient takes a glucose meter, they go home and they monitor themselves 99% of the time, and then they decide whether or not to take sugar levels. You guys are saying, okay guys, we're not just going to send you home with a device, we're going to tell you, based on the readings that we're getting, we're actually going to tell you what you should do.
Exactly. What you should do, and it's going to tell you, the patient, what you should do. Because this little device that's attached to the inhaler can have reminders built into the device, so you as a patient, or as a pediatric patient, you and your parents may have the ability to see and watch how the device will operate when you don't use it properly, meaning you don't actually take a dose. Maybe something like Advair or Seretide outside the United States is one puff or one dose in the morning and one dose in the afternoon. If you don't take the dose properly or you don't take it in the morning, it will have a ringtone or a monitor that lets you know, hey, you need to take that dose. That can show up on the iPhone or the Android, so a smartphone. So it can show up at the device, it can show up at a phone, Bluetooth, it can show up at the iPad, it can also go through an internet portal to what we call the Smart Inhaler Live Cloud. And from there, we can download certain information or even generate reports that are very useful for discussions between the patient and the physician about getting better at using your device properly.
As somebody with an asthmatic in the family, thank you, Jim, for what you're doing, and thank you for being here with us today. This is Hyrum coming to you live from Digital Health Summit studio.